I'm going to go ahead and get started. The topic for this evening is Bridging Cultures, Culturally Competent Approaches to Mental Health. This is brought to you by the City of Fayetteville Mental Health Advisory Board. On the call today, you have Vice Chair, Ms. Tracy Ricks, and myself, Board Member Ashley Martin.
Good evening, everybody.
Good evening. All right, let's just hop right on into it. What is cultural competence? This means providing care that understands, respects, and responds to people's unique cultural backgrounds and beliefs. In other words, the helpers, the counselors, the doctors, those service providers, value your culture in the healing process. It also involves being aware of one's own biases and adapting to the patient's needs. A culturally competent provider will respect your values and traditions while helping you with your mental health. The key is helping you with your mental health. As a provider, we definitely strive or should strive to help you. You're the captain. We should be the co-pilot. We should listen and respect your values and also be while being aware of our own biases. Okay? If there's anyone on the chat, this could be yes or no. Or do you feel as though cultural competence matter when it comes to those that you obtain services from? When care is culturally competent, communication and trust improve. You're more likely to open up when you feel understood and respected. This trust can lead to better diagnosis and personalized treatment. It helps avoid misunderstandings or misdiagnosis. Mental health symptoms can appear differently across cultures. For example, some people express depression as physical aches or fatigue. A culturally aware provider won't overlook these cues. Overall, culturally competent support makes people more willing to seek help and stick with treatment, leading to healthier outcomes. But let that sink in for a little bit because this is very important when it comes to being culturally competent, when it comes to communicating and trust. The more you have a trusting relationship with those that you decide to assist you with being of a service to you and for you, you're more likely to be more open during the process. Any questions for anyone? If not, we're going to keep going. Why cultural competence and mental health? Many minority communities face greater mental challenges but receive less support. Cultural barriers often keep people from getting help. Let's kind of break that down. Some cultural barriers often keep people from getting help. This could mean accessibility, such as transportation, means to fundings to do so, the outlets to be able to retrieve those services, and you name it. Only 1 in 3 Black adults with mental illness receives treatment. And for Latino adults, it's roughly 1 in 7 who get the care. These gaps are alarming. They show that standard approaches aren't reaching everyone. By understanding cultural differences, we can encourage more people to seek help and improve support for minority communities. Cultural awareness is definitely important, and it starts within our communities. And that's why we're here today to speak on it. Culture and mental health perspectives. Your perspectives definitely matter. Your beliefs about mental health differ by culture. In some communities, mental health may be seen as a personal weakness or a private family matter rather than a medical issue. This can make people feel shame or reluctance to talk about it. You especially may see that a lot in different communities. They may decide to go maybe to church or other family members, and that's totally fine. But this presentation is just to let you know that as a proficient, effective provider, they should definitely be culturally aware to help you meet your needs. And you know when you feel comfortable. Coping styles can differ. Many people first turn to family, community, or faith leaders for help instead of professionals, as I just stated. For example, some cultures may speak to a pastor or elder about emotional troubles before therapy, considering therapy. These supports can be helpful, but severe issues may require additional care. Expressions of distress vary. Culture influences how people describe what they're feeling. Some may focus on physical symptoms, the physiological symptoms such as headaches, tiredness, pain, when they're actually depressed and anxious. Understanding these differences is crucial so concerns aren't dismissed. The thing about symptoms, you know your body more than anyone else, and you know if you've been going to sleep with these symptoms, waking up with these symptoms, that this now is a concern. So speaking to someone just about these symptoms, even if it's your doctor, is important. It's okay to say something than versus to say nothing. Common barriers to seeking help. Stigma and shame, lack of access, language barriers, mistrust of the system. And we're going to dive a little bit more into each one. But before we do, if there's anyone on the call, if you wanted to chat in, yes or no, just a yes or no statement. Do you currently feel there's any barriers that you're dealing with to be able to seek some professional help? It's yes or no. Stigma and shame. Cultural stigma can be powerful. Many fear being labeled crazy or weak if they admit to struggling. Such norms and misconceptions discourage people from seeking help. Lack of access. Practical barriers like costs, lack of insurance, or few providers nearby hit minority communities hard. And when there are few or no providers who understand their culture or speak their language, it's even harder to find appropriate care. Language barriers. Not speaking the same language as your provider can lead to frustration and mistakes. If services and information are only in English or not in your preferred language, it's difficult to communicate your needs, resulting in inadequate care. Mistrust of the system. Historical injustices and discrimination have caused deep mistrust towards healthcare systems in our communities. Some people worry that providers won't take them seriously or will misunderstand them, so they avoid seeking help. I'm going to dive a little bit deeper into language barriers. Of course, all are definitely barriers, but due to time, when it comes to language barriers, You definitely will want to speak with your provider and ask if there are providers that may speak your language. If not, do they have interpretation services? And because you have a right to be heard. Finding culturally competent care. Ask questions when choosing a provider, as I just mentioned. It's okay to ask a therapist or doctor, have you treated people from my community before? Or how would you include my culture in your sessions? Good providers welcome these questions. Look for services that meet your language or cultural needs. If you prefer speaking Spanish, Mandarin, try to find bilingual providers or clinics. Some directories let you filter providers by language or cultural specialty. Community centers and places of worship might also have referral lists. I think we have something in the chat. Sorry. Let's see. What happened? Into the screen. Can y'all still see the screen?
Yes.
Okay. My end then. Okay. All right. We're going to stop for a moment and answer a question. What can be done to make therapy and mental health services more accessible in minority communities? First thing that comes to hand, within minority communities, it takes your voice to be heard. So if you are part of local affiliations like churches, for instance, speaking to your groups and minister about it, um, maybe they also may have some additional resources. You may want to talk to your community service boards. They may also offer resources. I know that United Way is a great resource. You just text them your zip code, what services you're looking for, and they'll send you a listing of different ones. But unfortunately, when it comes to the placement of certain services, they may not be in those communities necessarily, but does not mean that they're not places that can service you. So I will always recommend to ask so that you may find out. You may even be eligible to get transport if transportation is an issue. I do know that Uber and Lyft have partnered with Medicaid and other, insurances, so that may be another option. So like I said, these are just some things I kind of thought of if somebody asked me this question about how could it be more accessible. But Miss Ricks, do you have any additional?
I think you covered pretty much so what I would have said also. Just basically reaching out to those people that you feel could have the proper resources that you're looking for as far as making it more accessible. So I think you answered it very clearly.
Okay, thank you. All right, let's
And
see.
then, excuse me, and if it's a need in your community, that's something that you probably want to reach out to, like even with your local officials, city council and things like that. Because I know in the city of Fayetteville, once again, it's new. The board is new, but they're trying to make sure that we are meeting the needs of our local communities, the community here and outside as well. So that's something that if an individual is interested in it, just reaching out and also once again maybe go before the city council and you know just letting them know that this is a need and I think that's a great idea, so go ahead. Thank
I'm gonna have to share my screen again. Looks like it went away. Apologize for that, but we're back in business again.
you.
Uh,
Mhm.
let's see. We left off at use community resources. A primary care doctor or local community health worker may know counselors who are culturally aware. Support groups, in person or online for specific cultures can also guide you to the right resources. Basically, you deserve to be feel heard. After meeting with the provider, reflect. Do you feel respected? Did they understand your background? You should leave sessions feeling heard. If not, it's okay to look for another provider who better fits you. Your comfort and trust are essential. Okay. Supporting yourself and loved ones. Talk openly and listen without judgment. Breaking the silence is powerful. Sharing your feelings or personal story can help normalize mental health in your family or community. Encourage conversations where it's safe to say, I'm not okay, and others know that you're not alone. Blend cultural strengths with professional help. Embrace the coping methods that already exist in your culture, whether it's prayer, meditation, connecting with elders, or traditional healing practices. These can be sources of strength. At the same time, know that seeking professional help is not a betrayal of your culture. Okay? Both can work hand in hand. For example, you can pray and see a therapist. Community-based approaches leverage community strengths. Many cultures emphasize community, so mental wellness programs work best when they involve community figures. Faith leaders, elders, community health workers can be trained as mental health advocates, providing support in non-clinical settings. Outreach and education. Hosting dialogues, support groups, or mental health fairs in the community helps normalize conversations about mental health. Culturally specific groups, organizing support groups or workshops for and by specific cultural communities, such as a support circle for Black women, a workshop for immigrant parents, allowing sharing in your own language and context and reducing isolation. And lastly, collaboration with trusted organizations. Partner with local cultural organizations or nonprofits. All right, now we have Ms. Ricks to continue our presentation.
Mental health, wellness, and cultural pride can coexist. You don't have to choose between your culture and getting help. Therapy, prayer, meditation, community, music, food, these can all be part of your healing journey. And I know for me, I used all of them myself. So don't feel like one is, better than the other. But a lot of times with the combination, you can also receive the healing that you need. Know that mental health doesn't make you weak. In fact, talking about it and facing it head on is one of the strongest things you can do. I know in some cultures, mental health is considered to be a sign of being weak. But once again, I share this with my clients all the time. Seeking help is actually a sign of strength. Also, remember, embracing your cultural strengths, resilience, being able to bounce back, storytelling, spirituality, community. These are powerful tools that supports wellness. Also know that healing looks different for everyone. Your journey might not look like anyone else's, and that's okay. I was sharing with some groups today that it's like building a house. And when we're building our house, maybe you're renovating your house and you might be on ground one, laying the foundation again. And then someone else might be on level two. So know that as long as you're in the process of rebuilding that house, you don't have to compare yourself to anybody else's journey, their process. So know that, hey, this might be my friend's, um, you know, third layer to rebuilding her home or her new house. I might be on ground one, but as long as I've gotten started. It's okay. So know that once again, healing looks different for everyone. And my journey more than likely will not look like anyone else's around me. It's my unique path to my healing. So just remember that it might look different for you than it do others around you. So
That's
thank
true.
you. Let's continue on.
Okay, Miss Ricks, we do have a question. If it's okay for us
Go
to
ahead.
go
We
ahead
can
and
stop.
all right. The question is, what can parents do to create a safe space for mental health conversations with their children? While you think, Miss Ricks, I'll answer and feel free to say something too. I just had an opportunity to read it first.
Mhm.
First thing that comes to my mind is with your children, it's important to have a routine, a check-in routine, not just when something seems off or different, but even when something seems fine. Reason why this is important because checking in, you just never know what space your child could be in. But knowing
Mhm.
that mom or dad or auntie or whomever the guardian may be is checking in with them and listening to them isn't it can go a long way. It may open a door for a conversation to be had. But Miss Ricks, did you want to add to that?
Yes, I was just suggest vulnerability for me with my children that when I started my healing journey and I showed my vulnerability, letting them know it's okay not to be okay. It's just not okay to stay that way. And giving them that safe space to knowing that you're not alone, that you can come and talk to mommy about anything. And so I think it's important for us as parents to know that a lot of times, even when people are having mental health issues, especially children, that comes along with a lot of shame. Often they feel like, you know, it's just me having these issues. So I know for me as a parent, I would encourage all parents to just to show that vulnerability and to be um, just transparent and letting them know once again it's okay if you're not okay, but we're just not going to stay that way.
Yes. All right. Go ahead next.
For parents and caregivers, your children are growing up in two worlds, your culture and the one around them. Mental health support can help them navigate both. And I was thinking about now, with so much going on with social media, it's important to know that our children are definitely a part of two worlds. And one of them is actually physical, and the other, the online world, is really real for a lot of our youth today. So know that kids may face stress from school, identity, discrimination, or bullying, and may not always have the words to say it. I found out today through one of my group counseling sessions that a lot of bullying is still going on, and there's even some of the adults that were saying how they're still having bad side effects from bullying, in their high school days, and they're now in their 30s and 40s. So know that bullying and all that is major, and it can have major side effects as far as not being good for our mental health. So once again, kids may face stress from school, and most of them are. Even if you have a child that's in college, make that safe space that they can talk to you about their stress and what's going on. And once again, identity. Sometimes, even with identity, maybe confusion, they need to talk, so what you're thinking about, what? Allow them to speak about it. Also, with discrimination, it's a lot of that still going on. And know that they might not always have the words to say. Give them an opportunity to express themselves, though, as best as they know how, without the judgment. Also, once again, create space to talk. Ask, how are you feeling? Or what's been hard lately without rushing to fix it. Once again, I was the kind of parent I wanted to fix everything, immediately. But sometimes, they just want to be heard and not just get to a quick fix answer. So create that space for your child to be able to talk or whoever it is in your life. Maybe you're a caregiver, even if you're a foster parent, create space for them to talk. And most children will talk if given the opportunity. Be open to help. A counselor or mentor who shares your values can support your child's in ways or your children in ways that complement your parenting, not replace it. So if you have a counselor that's meeting with your child or a mentor that doesn't agree with your parenting skills, then that's not a good fit for you or your child because it can cause confusion. So be aware that you want someone who share your values and can support your child in ways that once again complement your parenting, not replacing it. And know that the earlier we support emotional well being, the stronger our kids grow. And I truly believe that the way the world is going now, that it's so vital that we do support their emotional well being at an early age. It's like children, even suicide rates are higher at earlier ages now than it was years ago when I grew up. So I would encourage all of us as parents or caregivers, aunts and uncles, that we allow them to speak their truths of how they're feeling emotionally at early ages. I'm talking about as soon as they're able to speak and talk and let you know what's going on. And once again, creating a safe space for them to talk, and trying to put yourself in their position. I know sometimes when we're older, it's like, I forgot about how it was the first day of school. But if that child is stressed, try to put yourself in their position. Maybe it's a new, once again, environment for them. Maybe they're not used to being away from home. We don't know. Maybe they're having some type of anxiety about being around other strange people. So just remember, it's very important that the earlier we support emotional well being, the stronger our kids will grow up to be. And there's so many broken adults who don't know how to process their emotions and regulate them. And I feel like it's because of the fact that they didn't grow up, with an understanding of how to do it, how to say, I'm not okay today. So these are some suggestions that I strongly agree with. So we can continue with the next slide.
Okay.
Conclusion and final thoughts. Everyone's culture matters in mental wellness. Remember that what you bring from your background, your values, family traditions, beliefs can play a positive role in healing. You deserve care that gets you. And I'm really passionate about having help that gets me, that gets you, that you don't have to try to explain things to them that they cannot relate to. So know that that's really important. Also, bridging cultures can break stigma. By openly talking about mental health and respecting different cultural perspectives, we make it easier for others to speak up and seek help. Together, we can create a more understanding and supportive community. Also, know that you are not alone. Whether you're personally facing challenges or supporting someone who is, know that help is available and help is real. It might take time to find the right approach or provider, but don't give up. There are people and resources ready to help, and I'm also one of them. Thank you for being a part of this conversation on mental wellness. Let's continue to support each other across cultures. Next slide.
We do have a question.
Okay.
What are some community-based solutions to addressing mental health disparities?
I'll let you answer, then I come behind you.
Uh, I would say that increasing your own cultural awareness can also help knowing more what's going on in your community. Because if you don't know, it's like you just don't know. So you may feel as though there may not be any resources, but maybe sign up for your city's newsletter, uh, being involved and more in the voting processes, just becoming more aware and more active in your community too can help address it because those are those moments where you could ask questions to those leaders and also you may also meet other like-minded people that may have some concerns that you may have or they may have more resources that you may know of. So that's the first thing that I think of when it comes to finding some community-based solutions to addressing this mental health disparities within your community.
Thank you. And we also have some resources we're getting ready to share with you all if you're in this community or in the, Fayetteville area or anywhere nearby. So we're going to share those resources with you guys in just a few minutes.
Okay, well, that was it. Let me go to the next slide, sorry.
Okay, resource, advice, help, support, tips, assistance, and guidance. Let's keep moving. Now, stress management and mental health. We have the City of Fayetteville Mental Health Hub, which provide tools and resources to support mental health and well-being. You guys see our city website that's on your screen right now. Behavioral Health Associates of Georgia offers individual counseling, family therapy, and stress management services. And we also have their website listed. We also have Fayette County Counseling Center, which provides mental health outpatient services, including individual counseling and case management. Also, we have Fayette Care Clinic, which offers free mental health services to uninsured residents of Fayette County. We also have Georgia Crisis and Access Line, 24/7 crisis support. So these are also, once again, great resources to have on hand for stress management and also overall mental health. Next slide. Now, if you need food assistance, we have the Fayette Samaritans. They provide food, clothing, and emergency financial assistance. We also have Real Life Center. They offer a mobile food pantry and other support services. We have Georgia SNAP program. They assist low-income households with monthly benefits to purchase food. And then also we have a link for Find Help. So these are also great resources to have on hand if you need food assistance.
Yes, and we do have another question before we go to the next slide. Is this a good time?
Yes.
Okay. What are some signs of unresolved trauma that people should be aware of? And like I said, I've read it, been able to read it first, so I don't mind answering
Go ahead.
first, and then Miss Ricks, you can definitely chime in. When it comes to trauma, comes in different symptoms that a person may or experiences that a person may have experienced. So I would just say, you know yourself, or that person may know themselves more than anyone else. So whatever physiological symptoms, I would say that keeps reoccurring or they keep expressing or experiencing, they should definitely seek some additional uh, support within their community to be able to talk about that in a safe space so that it can be identified. Only you know your signs, but physiological, symptoms could be reoccurring thoughts, nightmares, terrors, things of those natures. Um, the list can go on and on, but that's just, a quick I guess more so overview of what some signs could be.
And I'll just list a few to go along with that so they might can have more of you know, um, a more in-depth, I guess, list of some signs to look for. Intrusive thoughts, avoidance behavior, of course, that high anxiety, emotional numbness, I'm just here, difficulty trusting others, mood swings, self-destructive behaviors, feelings of guilt or shame, physical symptoms in our bodies, and trouble concentrating. These can significantly impact our daily life, and these are some of the major signs of, you know, there's some type of emotional trauma going on in my life. I hope that helped you guys.
Yeah, and the biggest thing is if it's interfering with your day to day, if it's interfering with your relationships, your work, etc., then these are some signs that there's something unresolved situations that you may want to seek assistance in.
Okay, thank you.
Mhm.
So we can go to the next slide. I think that did it. Educational support. We have Fayette County Public Schools. They provide special education services and resources for students with disabilities. We have their website on the screen, Joseph Sam School. They offer programs for children with special needs, including speech and occupational therapy. We have AB Pride After School Enrichment Program. I think I pronounced that correctly. Am I correct?
Yes, that
Okay,
yeah.
because I'm like, I think I pronounced that correctly. But they provide K through 5 students with academic support and enrichment activities. And we also have their website listed. We can go to the next slide. Housing support. We have Bed Factors Operation Help. They assist families with housing and utility payments to prevent homelessness. We also have Georgia Housing Choice Voucher Program. They provide rental assistance to low-income families, the elderly, and the disabled. Also, Low-Income Home Energy Assistance Program, which helps low-income households with their home energy bills. So we also want you to be aware of the websites that you can go to. You can screenshot it or reach out to us if you want us to, maybe send it to you in another way, as far as maybe emailing or put it in the chat, and we'll make sure you get that information so that you can have it on hand.
Okay, we have another question.
Okay. Glad you guys are engaging.
Yes.
That's awesome.
Sometimes supporting those with mental health challenges can be overwhelming.
Okay.
How can I connect a family member to behavioral health providers? Um, Depends on the age of the family member as well. Not can't force anything, of course, on anyone, but I believe giving the information is just as helpful. Even allow them to say, hey, if you don't want to do this alone, if you don't want to do your intake alone or the paperwork alone, or I'm gonna be here, to assist you. I want to be able to assist you. This may show them that you would like to support them in that way. That may be a great way to help them connect that family member to behavioral health providers. If they do have insurance, they can call that number on the back of their insurance card to see what providers may be in their area that accept their insurance. So that way you have a list of providers that you can call or they can call. Um, you can be specific as far as you want a male or female or availability online, in person, etc. So that's the way there. Miss Ricks, do you have
No, I
anything
didn't have
to add?
anything to add on.
Okay.
Thank you.
Next question. How do you know when it's time to seek professional help? Uh, Once again, I've been able to read the question first before Ms. Ricks. As I reiterated, only you know yourself. You know your routine of habits. And if it's a habit of you being in a level of distress, then I would say that is an indicator that you may want to seek help, meaning you may want to be able to speak in a safe space without any bias or judgment. Ms. Ricks, do you have anything to add to that?
No, I think you answered it um, pretty well. But I will just interject just a little bit, saying that usually if you have to ask that question, that's a sign that I do need help. So that's what I was
Yeah.
going to add to that. If it gets to the point the window, gets to the point where it's too far gone, usually that's a sign that I need to reach out.
Okay.
Next slide.
All right.
Almost done. Financial assistance.
Assistance.
We have Bed Factor. They provide emergency financial services, including rent, mortgage, and utility assistance. We have Georgia Rental Assistance Program. They offer up to 18 months of payment relief for eligible applicants. St. Vincent de Paul, Georgia. They assist with financial aid. Contact their assistant line at 678-892-6163. We also have listed their website, or you can dial 211 This connects you to local financial assistance programs, including help with rent, utilities, and more. And we also have their website available.
Okay. We do have a few more questions, but you can finish off the
Yeah,
presentation
and
and
then
we'll
we'll
do
go
one
into the,
question.
okay,
Yeah.
okay. From the Mental Health Advisory Board of the City of Fayetteville, we want to thank you for your commitment to your mental health and community well-being. You can also contact Councilwoman Dr. Naya Glover, and she may be reached at nglover@Fayetteville, of course, Georgia.gov. And then we also have a direct link up there for the mental health hub. And I also want you guys to know that as the vice chair of the board, that we are very passionate about our community and our mental health and our well-being. So I just want to let you guys know that you can reach out to Dr. Glover or go right to that mental health hub, and someone would definitely reach back out to you. So thank you. Back into your hands. And I'm done for right now. If there's any questions, I'll stay on.
Okay, same here. We do have two other questions, and thank you everyone for joining in. Next question is, how do you deal with a family member in denial about their mental health? I would say, as I mentioned before, you may see, notice symptoms that a family member could be in mental distress or have some concerning issues when it comes to their mental health. As being a support, I would say the best role to take in that is to offer the information, but don't allow that to stress you to the point where now you become frustrated um, about it. So all we can do is offer the information and be as supportive as we can. Everything outside of that is really up to that family member to seek the help that they need to get ultimately. Um, Inviting them to webinars such as this. This could be something collaborative that you can both do together. So that way you don't feel as though you're pressuring them about anything. So maybe just having an open discussion like this could definitely help them being in attendance. So next time we have one, just maybe send the invitation to them as well. Miss Ricks?
And also, I would add on to that, maybe sharing with them that you're on a healing journey and that you are actually, seeking help.
Yeah.
Once again, we can't change or force anybody to do anything they don't want to do, but I would definitely be praying for a change of heart because mental illness have destroyed so many families, marriages, homes, because we can't do what we're not aware of what we're actually doing. We can't do any more than that. And a lot of times in certain communities, we look at it as normal, certain things that might not be normal.
Yeah.
That's usually not normal. I put it that way. So I know for me, I am very vocal about my mental health journey. And I pray that people around me who know that I'm serious about it will want to join me on that journey. And if
Yeah.
not, it's okay. Like you said, you can't carry anybody, or, I'm not going to allow it to cause me to be irritated with that person and frustrated, because it is something that a person would have to make up their mind that they want to do. And if they're not mentally able to do that, we can't lock people up. I know back in the day, they would lock people up like, oh, okay, you need help. But from what I'm understanding, we can't do that. So, and of course, I believe in prayer. I would pray that, they would have a change of heart if their heart is not there to do it. And of course, I like the suggestion you made, like maybe webinars like this, something to let that person know that it's okay, once again, not to be okay. But we just don't want you to stay that way. So,
Yes. We have another question. What is the difference between mental health and mental illness? Um, I would just say mental health is like the umbrella. Mental illness is actually what the person could be dealing with. So, as we know, there are various diagnoses. We could consider mental illness or mental diagnosis, but the mental health is like the classification of what a person could be dealing with. So that's how I would describe the difference between mental health and mental illness is just more so a further description of what that person could be going through within their mental health.
That was good. It's a good explanation.
Let's see if we got any other questions. Okay. What are some daily practices or coping strategies to support well-being? First thing that comes to mind, you have to be willing to be consistent with your practice. It takes at least 30 days to develop a new habit. So, with that being said, whatever old habit that you're trying to get rid of or minimize, you have to be willing to replace that with something new and be consistent with it. No one said you had to do it every hour on the hour, but be consistent of how often you do it within a day. So whether that's taking a walk, whether that's taking a break at work, actually taking a break at work without being on your phone or watching something that's taking some time for yourself, coping skills, there's a slew of them. Everything that may work for me may not work for you, but um, diving into those interests, hobbies, um, those things that when you think of it, it puts a smile to your face and brings you joy. I would say those are coping skills. Miss Ricks?
Those were great, what everything that you suggested. But also, I want to add at the top of the list, all of those consist of self-care. Know that my mental health, my overall well-being is my responsibility as far as maintaining it, and developing it. So for me, self-care is vital. I always tell my clients that making you a top priority, not pouring from an empty cup, deciding that, hey, I want to be there first of all for me, and then I can be a better value to those around me. And I know a lot of times, especially with women, I specialize in women, we're so used to pouring from an empty cup that we become burnout. And so then we take it out on usually the wrong people, and then it comes out in our bodies. So I would suggest, once again, making self care a top priority. And I don't mean just getting my hair fixed or my nails. Those are good things, but things that's going to keep my mental health at a healthy place. So once again, I walk every day, regardless of what's going on. I'm going to walk because it puts me at a great state of mind. I do a lot of affirmations to keep my mind at a healthy place. I do a lot of inspirational, maybe videos, podcasts. I pray daily, talk with God, because he's going to listen regardless of nobody else is listening. I also have a community support group. And so I stick with that support group. We meet virtually every other Monday night. It's a powerful group of women that we come together and we're in a safe space and we're all on our same journey. So maybe joining a community support group or whatever it would take to make your self care and your mental health and your overall mental being a top priority and sticking with it. As you said, the 30 days, but actually, according to updated research, it takes 21 days to start a new habit. And then to develop it, it takes even longer than that. So just getting started somewhere and every day saying that I'm going to get up, but this is my commitment I'm making to myself. And then also have an accountability partner, maybe a coach or your therapist, a mentor. I mentor women and I let them know that I'm here for you. Maybe on those days that you feel like you're not doing enough as your mentor, your therapist, I'm here to say, girl, I have your hand. I got you. We're going to walk on through this. I've learned that without the right support system, it's hard to not just get started, but stick with that commitment. So knowing that there are resources out here, support groups, um, you know, and things like that, that maybe you're not aware of right now, but look through the resources and find out and reach out to us. And these are the things that I'm doing consistently. I make a commitment to myself that my mental health is a top priority in my health, in my life, for my overall well-being. So thank you. I hope that answered the question.
Think so. Just go back through, make sure.
Mhm.
All right, you're welcome. And thank you all who were in attendance. And I hope that everyone has a great rest of your night.